Thank you, Susan, and thank you for inviting us to this lovely campfire and inviting us to present the paper on healthy and sustainable diet in early life and the relation to mental health and personality later in childhood. I would like to acknowledge the co-authors of this paper and just briefly tell you that we are joining from the southern part of Norway and the University of Agder. So the findings that I am to present builds on the knowledge of the fundamental importance of nutrition and dietary intake early in life, with different nutrients being important for different aspects of growth and development. And in addition, as you've mentioned, the importance of diet early in life for later health and disease, as shown in this figure inspired by Prescott, showing that early diet may affect a wide range of disease outcomes later in life, and that healthy diet is important for long-term health. The last 10 to 20 years have shown that we cannot only evaluate diet related to human health, but also planetary health. And in this project, we therefore try to identify a regional diet in line with the Mediterranean diet, but with a Nordic approach, consisting of largely healthy foods native to the Nordic climate. So the relevance of relating diet to mental health is the enormous rise in mental health disorders, with an increase of 48% worldwide from 1990 to 2019, according to the Global Burden of Disease study. There are only a few studies who have evaluated the relation between early diet and mental health, and to our knowledge, none on personality traits. So the aim of our study was to investigate the potential associations of exposure to a healthy and sustainable antenatal and early childhood diet with personality traits and child symptoms of depression and anxiety. To explore this association, we used data from the Norwegian mother, father, and child cohort, which originally includes more than 100,000 mothers and children who are followed from pregnancy up till age 15, 18, but we've included data up to 7 years, and mental health data from 8 years. And in our study, more than 40,000 were included, and we have each time point, or the diet at each time point, has been related to mental health at 8 years. So for the exposure in this study, way back in 2013, we developed a maternal dietary score in the MOBA dataset that aimed to capture the concept of a Nordic diet, focusing on food that could be grown in the Nordic countries. It included 10 different aspects of diet, as meal patterns, Nordic fruits, root vegetables, potatoes, wild fish, water, and more. The last years, we have developed child dietary scores, trying to resemble the maternal score. However, due to different levels of details in the questionnaires, these scores are a bit different than the maternal one, but they all include fruits, vegetables, homemade food, fish and water, and intake of milk. So for the outcome measures on mental health and personality, child symptoms of anxiety was measured using a short version of SCARED, and depression symptoms by a short version of the mood and feelings questionnaire. Mothers scored their child, and higher scored indicated more symptoms. Child personality traits were measured using hierarchical personality inventory for children, measuring 5 broad personality trait domains, responding to the big 5. And the personality traits are extroversion, benevolence, neuroticism, conscientiousness, and imagination, with the green ones being described as beneficial for mental health. So what did we find in this study? For the association, we used linear regression models to analyze the association between diet at the different age points and mental health symptoms. We found quite consistently that a healthy and potentially sustainable diet at all age points, except 6 and 18 months, gave lower scores on depression symptoms, while similar associations were found for diet at 3 and 7 years for anxiety symptoms. We did adjust for quite a few confounders, such as maternal age, education, maternal depression, and more. The associations between diet and personality traits show that a healthy and potentially sustainable maternal diet and diet at 18 months, 3 years, and 7 years give higher scores on the personality traits, extroversion, benevolence, conscientiousness, and imagination, and lower scores on neuroticism, underscoring the importance of a healthy diet early in life also for the development of personality traits. So, of course, there are limitations with our study, and this is just one. You all summarized very well the different fields that you have presented. And this, although this is a longitudinal study with a high number of participants, the data must be interpreted with caution. We do not describe causality. The data are self-reported with all the limitations of misreporting, and the results should also be replicated regarding the personality traits. So to conclude, our results indicate that a healthy diet early in life may impact mental health and personality development during childhood, which is of course important in a public health perspective, and just adding to the literature on the importance of promoting a healthy diet in early life. So thank you.